and for taking the time to be with us today. As I said, I am Nicole Culos-Reed. I'm the director of the Thrive Center and the Health and Wellness Lab in the Faculty of Kinesiology at the University of Calgary. This is our very first ever Exercise Oncology Education Week. And this was really put together to share a bit more about some of the programs that we have, the resources that we build, and the goals and the mandates of the work that we're doing. It's been a bit of a different year for all of us, and we've really pivoted in my lab to be able to bring some of the same programming and resources via technology, via Zoom, like we're doing right now. Before I get started, I do want to acknowledge the traditional territories that we all, wherever we are today, live, work, and play on across Canada. We have people today joining us from Ontario and Saskatchewan and Alberta. In Calgary, I want to acknowledge that we live and work within the traditional territories of the Blackfoot and the people of the Treaty 7 region. This also includes home to the Métis Nation of Alberta, Region 3. In addition, I do want to acknowledge that the Health and Wellness Lab champions equity, diversity, and inclusivity within our team members, the research questions that we investigate, the training that we provide, the programming we develop, as well as all of the other resources, educational or programming wise. And so with that, today in the next 15 minutes, this is short and sweet, as I've said, I simply want to provide an introduction to the Health and Wellness Lab, who we are and what we do, and really why we do this, the reasons for providing exercise for individuals living with cancer. And then finally, I'll leave you with just a little bit about the resources where you can continue to learn more. A lot of the other sessions this week are really going to build upon some of the information that I start to present to you today. So who we are, well, we're maybe not artists, although we tried. We had a fun Zoom paint night, and this just gives you a glimpse at some of the people in our lab. Over the past year, similar to you, the interactions for us have been primarily virtual. We've been working together as a group via Zoom for the most part. This is a picture, the next one of us pre-COVID, obviously, so I will state that up front. This was one of our, what we used to have, many social gatherings as a group. But as you can see here, we're a large group. We are faculty, trainees, postdoctoral fellows, PhD students, master's students, and staff, clinical exercise physiologists, research assistants, and coordinators. We are a tight-knit group that really share this passion for bringing exercise into the lives of those living with cancer. And so we have kind of two big arms at the University of Calgary in the Faculty of Kinesiology, and that's my Health and Wellness Lab and then our Thrive Center. So the Health and Wellness Lab conducts research and develops movement-based programs, including using exercise and other modalities such as yoga to help individuals living with cancer move from simply surviving to thriving. And this Thrive emblem you see here up on the screen, this is actually the painting that's on the wall in our Thrive Center. So when we speak about thriving, we're really talking about that all-encompassing domains, including the physical, functional, and psychosocial. So we're not simply using exercise to improve people's physical well-being or physical outcomes, but really using movement modalities and having people engage in thinking about moving more as a means of improving their overall sense of well-being and quality of life. And you're going to hear me use different terms, and throughout the week, you'll see some of these introduced in definitions, including, I think, in Julia's talk. But these differences between exercise, physical activity, and movement. And while many of you, I noticed as we shared intros at the beginning, before the presentation, we had lots of participants joining us today, and you're in our exercise programs. And that's really the more structured physical activity for the means of achieving certain health-based outcomes, physical and psychosocial. However, really, we want you to start to think about this idea of engaging in more physical activity, or simply just moving more. And what does that look like for you if you can simply move more throughout your usual activities? I always say when I give talks like this, it would really be nice if we had headphones on and we're all out just walking around and listening, right? Because then we wouldn't be sitting down and engaging in a sedentary behavior. So I encourage you throughout all of the sessions you might be attending this week is to move while you're sitting there listening and learning, right? It could be up and down out of your chair. You could just be stretching your arms, but take some movement into the time that you're sitting and learning and thinking about really how are you building your habit of moving more. And really, the Health and Wellness Lab and our Thrive Center, which is a physical space at the university that some of you may have seen pre-COVID, but really the mandate of what we do is simple yet complex. Our goal is to change the cancer care system, right? That's a pretty big thing that we're looking to do, but we firmly believe that we must include wellness in the cancer care system via physical activity and exercise resources to really support people along the care pathway and to support all cancer survivors. And so this means expanding beyond those who might have usual access, opening up our doors to reduce the barriers for other individuals, and ensuring that as we provide wellness via physical activity, exercise, or simply movement, that we are taking into account the individual needs and preferences. So for those of you that are familiar with our programs, we do run, as you saw in the picture here, or the one down below on Zoom, we do offer group-based programs to really harness the value of building this sense of community. And we feel that if we can do this and provide the evidence base behind what does this provide for individuals living with cancer, that we can use that evidence to build that into the traditional cancer care pathway, where wellness isn't the focus, right? In that care pathway, it's focused on the illness and how do we cure cancer? How do we move people beyond from treatment into living with cancer? And so we know if we can bring in this wellness aspect, we're going to enhance well-being and improve overall quality of life. So we are a number of things through what we do. And the first one is that we are a community. So this isn't simply about building exercise prescription. We do that, and we do that really well based on solid evidence and having really well-trained staff, right? Those individuals who are leading your classes are providing the best evidence-based fitness prescription. But it's about moving beyond that. It's about bringing people together who share this common journey and giving them this moving support group, this ability to connect with others, to share experiences, to talk about resources, and to really build that support that we know is integral to developing the habit of moving more. Right? So we, yes, give you a 12-week program, we bring you all together, but hopefully we're helping you within that build the skills and connect with others that will lead you beyond these 12 weeks to living a lifestyle that has physical activity really ingrained into it. As I mentioned, we are research and community-based programs, and I've put the emblems up of our active ones right now. Many of you that are on the call have been either participants in ACE, our Alberta Cancer Exercise Program, or are part of Excel, our newest program, and that is Exercise for Cancer to Enhance Living Well. Excel really builds on the 5 years of ACE success that we've had and brings that same Alberta-based model across the country and really accessing and providing, increased access for individuals who typically haven't had access to an exercise program, those living in more rural, remote areas, so outside of our major urban centers. We've also had programs that have been in our community for a number of years now. Yoga Thrive is our yoga-specific program for individuals living with cancer, and it's been running in the community for a number of years. It was actually the very first program I developed when I began at the University of Calgary way back in 2001. Then we've got some specific programs that are geared to certain populations. So one of our big ones is called True North. And this is funded by Prostate Cancer Canada and the Movember Foundation. And it is about bringing lifestyle management resources for all men living with prostate cancer across the country. And so it can be embedded within our other programs to provide additional support for men living specifically with prostate cancer. The last two you see up there are really unique to what we've developed here in Calgary. Thriving One-on-One is a more personal training, additional support program that Julia and Maddie and Sam and people in our lab have run through our Thrive Center. And this offers individuals the opportunity to maybe get some more one-on-one support or a program more specifically for them that they can use to further move forward in their exercise prescription. So a really great program that we've been able really to offer based on philanthropic donations. So there's no charge to our participants when they come into this program. And then the last one is taking this outside of our adult world. We've got a whole program of research that is built over the years, specifically focusing on the role of movement for children with cancer, children and adolescents. So our peer program started as a research-based program and now runs as a community-based program out of Children's Hospital, as well as some community sites in partnership with Kids Cancer Care. And so this has been an amazing program that is continuing to evolve. And as we've learned more and built more resources specific to pediatric oncology, we're excited to see this grow over the next few years with some in-hospital programs to really set this population up for more success as they complete treatment or move into longer-term survivorship. And so why do we do all this? Why build the programs, build this sense of community? And it's because we are building this impact on wellness. And I wanted to share this quote that came from a former ACE participant that speaks about, that this just isn't an exercise program. This is so much more, and talks about the ACE program as a gift and the sense of purpose that it gave back. And that sense of purpose, that's really why I started way back when in building a program around exercise oncology. It was this idea of being able to give back to individuals that sense of control that is often taken away with a cancer diagnosis. There are a number of modifiable lifestyle behaviors that we are in control of, right? Our nutrition, diet, sleep, stress levels, and our exercise, as well as some other choices, right? Smoking, not smoking, sun behaviors. But exercise is really one that has got this growing evidence base, and that we know if we can get individuals who can start at a level that's appropriate for them and build up with success over time, that we're much more likely to see that sense of control come back over what they can do to live as healthy as possible. And so Brian, I think, really nicely speaks to the importance of these cancer-specific programs that we've built, the sense of seeing themselves as somebody who is part of this program and connects with our leaders and the other participants. And really this last piece that he mentions here, this feeling of belonging, not being alone with my cancer diagnosis. And that feeling is, I think, so very important to mental well-being while dealing with this disease. And so I will end it with resources. You're going to learn so much more over the next week, and all of these talks will be posted and available on our website after, as long as a whole host of resources that you'll see there. So we're building more and more, especially as we're trying to ensure we can facilitate access to resource during the pandemic, but also after, so that individuals can always come back to our site to find videos, education, or other resources to support living well. And so if you want to find out more, 2 resources right there, our website at the University of Calgary, and then our Thrive Health Services training website, 2 really great sources for more information. Volunteer students that are here, Julia or the lab email if you're interested in getting more involved. And for our participants, if you have questions, if you want to find out more, you're interested in some aspect you heard about just now, or you just have other questions, always the easiest is to contact us at Wellness Lab. Because we are remote, this is the best way to get in touch with us to ensure that we'll get back to you in a timely manner. And so with that, I just want to really thank my entire team, many of whom are presenting this week and sharing the expertise that they bring to the group that we've built. I also want to acknowledge the primary funders of the ongoing work that we do, including the Canadian Institutes of Health Research, Canadian Cancer Society, the Alberta Cancer Foundation, Alberta Innovates, the Movember Foundation for True North, and the University of Calgary. And so with that, I am going to stop sharing, and we will start